Welcome to another edition of Lengthening is Amazing. Today's session is about laser crown lengthening. In today's session we can see that we have a recurrent caries underneath a lower right first molar. Closer inspection reveals quite a large lesion, carious lesion underneath the mesial buccal line angle. We sectioned the crown, removed it, and upon further inspection and increase in magnification we can see the extent of the caries on this asymptomatic lower first molar. Patient wished to save this, so you can see the aggressive carious destruction. We decided to try and remove some attached tissue and see the apical extent of the caries. We've now put the laser in gingivectomy mode. We're using an MZ5 tip with about 10% water, 2.25 watts, and 30 hertz. We're using it in H mode, and we're using it with 50% air. We estimate the amount of soft tissue we want to remove, and using an external bevel approach, we remove this tissue in one fell swoop. Gingivectomy is done first initially to try to remove the attached tissue that's overcovering the apical extent of the caries. Gentle sweeping motions back and forth, slowly going further and further into the soft tissue, we're able to actually isolate the caries and be able to see whether we can indeed save this tooth. Now you have to make sure that you have enough attached tissue when doing this procedure, that you're not going to remove all of your attached tissue in doing this. Now once the tissue has been removed, then we do some fine tuning, which is just called gingivoplasty. Some prefer to increase the hertz at this point to 40 or 50 hertz to smooth it off a little bit. We kept it at the same settings. What we're doing is just really cleaning up the bulk of the tissue that was removed and making sure that we have a nice smooth cut of the soft tissue. It is absolutely imperative that after we've removed the soft tissue portion that we turn our laser towards the bone to do the bone plasty or osseous recontouring. If you fail to do this, you will end up infringing upon biologic width. The MZ6 tip is used at 2.5 watts, this time with much more water, 80% water, 75% air, and again in H mode. S mode is only used for soft tissue. You can see here that what we're doing is trying to create a 2.5 to 3 millimeter biologic width, where the bone is pushed back with the laser and done in a closed, flat manner. You can see we're working now in the furcal area to try to improve the amount of pocket that is in this particular area. The laser is also used to remove the existing caries that is present, to remove the smear layer, to create a nice clean surface that's void of bacteria prior to doing our core buildup. Ordinarily, when doing crown lengthening, the minimum amount of healing time is usually in the 12 to 16 weeks. In our particular case, we're going to wait less than 3 weeks to put the crown in, and we've taken the impressions for the final restoration on the same day. You can see some fine tuning here, gently slipping our MZ6 tip underneath the soft tissue and ensuring that we do not remove all the attached tissue that is present. If you have to remove all the attached tissue, then it is necessary to apically reposition your flap. Immediately after the osseous is done, you can see very little bleeding. You can see a nice clean surface, smear layer removed, and we're able to now focus on doing our core buildup without any seepage. Our core buildup is complete, the rest of the crown preparation is completed, and now we turn our attention to crown troughing. An impression is taken the same day as the osseous crown lengthening, and a provisional restoration is placed. 2 weeks later, the patient returns. 17-day healing shows remarkable healing of the soft and hard tissue. Provisional crown is removed, and you can see a beautiful soft tissue result here. Very little inflammation is present just 2 weeks after. You can see even the crown troughing has resolved nicely. The final restoration is zirconia crown is placed, and at higher magnification you can see an ideal result accomplished in only 2 weeks. I want to thank you for watching, and keep lasing. It's amazing.